Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome back to another segment of The Rankin Difference featuring Dr. David Rankin. Today, we're covering breast implant illness, a condition that isn't well understood, but that can be debilitating. I can vouch for that. BII refers to a wide range of inexplicable symptoms that basically can't be explained by the medical community that develop in women who have reconstruction or cosmetic enlargement with breast implants. It isn't an official medical diagnosis because it's just still not well understood. BII, breast implant illness, is an increasingly recognized condition that is going to affect many women to come with implants, with symptoms ranging from fatigue and brain fog to autoimmune disorders and even rare cancers like breast implant associated anaplastic large cell lymphoma. I know it's a big word, BIA-ALCL. And despite these reports, BII remains under research and controversial within the medical community. So today we're joined by our expert and recurring contributor, Dr. David Rankin. He's a top breast explant expert in the US and the chief of plastic surgery at St. Mary's Medical Center in West Palm Beach, Florida. He has been in practice for over 20 years, but he's very well known in the BII community. We're going to explore the complexities of breast implant illness, what current research is telling us, and how women can make informed choices about their health. Welcoming now to the show is the amazing Dr. David Rankin. Welcome, superstar.
Hey, Zen. Great to be here again.
So excited to have you on. So for the audience watching and listening, in your own words, exactly what is breast implant illness and why does it remain such a controversial topic in the medical field?
Well, like you said, it's an association of many symptoms that women are experiencing through their breast implants. It's controversial because there's really no way to give a definitive diagnosis. There's no blood test. There's no radiologic examination where you can definitively say you have breast implant illness. It's more of a diagnosis of exclusion when you've ruled out other factors. Once you rule those out, you get a diagnosis of BII or breast implant illness.
So your experience working with patients affected by BII provides such an invaluable insight. And not only am I a former patient of yours, but I follow your page, and the information that you're putting out is extremely critical that women understand that they could be part of this demographic. What are the most common symptoms of breast implant illness, and how can women differentiate these symptoms from like any other health condition?
Well, there's a tremendous amount of symptoms that I see in my practice. The FDA has finally come around and recognized breast implant illness and even have it on their website. And they list the most common symptoms as brain fog, anxiety, joint pain, skin rashes. But really, I see a lot of GI issues, exacerbation of autoimmune issues. You name it, I've seen it. It's, again, not something we can diagnose through blood work or other types of studies. And having your implants removed, it is a leap of faith. But lo and behold, in my practice, I see most of my patients improving in their health.
So when you see these consistent symptoms over and over and over again, and then you explant these women and everything poof goes away, what do you have to say for that?
Well, I mean, the proof is in the pudding. And, when 85% plus of my patients have improvement in their health after explanting, it's real. We need further studies to determine the root cause. And I think, doctors doing a lot of explants and are really working on this along with the medical community. It's becoming more recognized amongst my peers and colleagues, even in other subspecialties that are referring patients when they see their patients improving also.
Yeah, and your practice essentially is the study, right? It's the study. You have a couple of year waiting list to even get to a patient. You are very well known in the community. And like you said, 85 to 90% of women that you explant, their symptoms go away. And women experiencing symptoms like chronic inflammation and joint pain or these unexplained fatigue, they often find themselves dismissed or misdiagnosed. Like, let's not forget that. And this overlap with other conditions totally makes breast implant illness particularly difficult to pinpoint. And so understanding the commonalities in reported symptoms can totally empower women to seek the right care. And that's exactly what you're all about. And I love that about you. What does current research indicate about the potential link between breast implants and cancer, such as what I mentioned in my intro, BIA-ALCL or other cancers?
Well, we know it's a correlation and a connection, particularly more with textured implants than with smooth implants. The BIA-ALCL, which you mentioned, and also we see a squamous cell carcinoma, which is a cancer within the scar tissue or shell. It is very rare, but it has a higher mortality and morbidity than the BIA-ALCL. So that's something that we're studying now as well.
Yeah, and while these risks still remain relatively low, they are significant enough to prompt FDA warnings and heighten awareness among patients, right? Especially with that black box warning that came about on all implants across the board in October of 2021. So it's an actual thing right now. It's not just hyperbole. Can you explain the differences between silicone and saline implants in relation to the connection to BII and cancer risk? Are there specific materials that are more concerning?
Well, silicone and saline implants both have a silicone outer shell, and that shell traditionally is either a smooth surface or a textured surface. The texturing was made to try and reduce capsular contracture or hardening of the shell around the implant. We've seen more issues with the textured implants than with the smooth. However, there's concerns with both. Enough of an issue that the FDA took off the Allergan textured implants from the market a few years back now. So we know there's concern more with the texture, but both implants, particularly with BII, can cause symptoms. It's just with the cancer diagnosis, the texture we see more commonly.
Yeah, I was reading up on it. Silicone and saline implants have distinct characteristics that influence their risk profiles, but silicone is often praised for this natural feel, but it is more commonly associated with inflammatory responses, which raises questions about its safety compared to saline. But you can't dismiss the saline because I had saline and mold was growing around the valve, right? So, like, you just don't know. And the research is still not potent enough for us to draw conclusions. Now, for women who want additional volume, but prefer to just avoid implants altogether, what options do you offer and how effective are they in achieving these natural looking results? So to say, I know it's not going to be how it was before, but what do you recommend?
Really, the best thing we have is fat grafting. So it's traditional liposuction. We collect it in a specialized mechanism made for fat grafting. It's injected into the breast. The nice thing about it is it's your tissue. It's not a foreign body. The downsides really are it doesn't give a complete implant look. Really, we can increase breast volume by maybe a half cup to a full cup per procedure. So some women have to have it repeated, but it's the best thing for long-term volume increase without using, a device that's foreign to your body.
Yeah, minimizing long-term risks. That's what it's all about.
Yeah.
How important is the removal of the capsule during explant surgery, and what are the risks of leaving it behind for patients with BII or even cancer concerns?
Well, that's a controversial topic. If you speak with the American Society of Plastic Surgeons, they've done some studies which they say, a partial capsulectomy or partial removal is just as good as a full removal. I think if you look at the studies with cancers and cancers forming within the capsule, it just makes much more sense to remove it and bypass any possibility of cancer development down the road. Also, I think personally, there is going to be evidence that comes out that the capsule has something to do with the breast implant illness symptoms too. That's anecdotal at this point. It's just what I see in my practice is full removal equates more to symptom relief than partial removal.
Now, how has social media influenced the rise of awareness around BII and the demand for explant surgery?
It's been fantastic because it's an educational tool, and a lot of these sites are women speaking to other women and giving their experiences. It's bringing light to the fact that this even exists, because it's been kind of, like we talked about, poo-pooed by the medical community for a long time and brushed aside. And these patients have not had a voice. They haven't been aware that their implants can be causing some of the debilitating symptoms they're having within their life. So I think social media has done a tremendous job in educating women and the public in general that this could be a possibility.
Now, lastly, I would like to know your thoughts. The new Motiva breast implants. Surgeons seem to be pushing these to women who have previously suffered from breast implant illness, specifically because they are recently FDA approved, and extensive research has been occurring since 2018. They're considered to have a very low risk of rupture, with manufacturers claiming that rupture rate is less than like 1% due to apparently there's a unique design and high quality silicone gel, making them one of the more safer options on the market. And they're also claiming that the implants come with a quote unquote always confident warranty, which covers replacement in case of a manufacturing defect related rupture. Okay, what do you have to say to this?
So I know you're speaking about the Motiva implants, and they've been around a while. It's a company from Costa Rica. They were recently FDA approved in the United States, I think November of 2024. We've seen a lot of implants, a lot of implant companies come and go. They redefine their gel. They make it more cohesive. It gets on the market, and it's always the greatest new thing. So I think time will tell. It's being put out there as a smooth implant, but really it's not quite a textured implant, but it's a nano texturing surface to the implant. And I think, when some of the other implants went on the market, they were told to be, less capsular contracture, less rupture, all these things in the past. So I think in the future, my guess is they're going to prove to be very similar to the implants we have on the market now, but time will tell.
Time will tell, right? Time will tell. But the part that gets me is that quote unquote always confident warranty, which covers replacement in case of a manufacturing defect-related rupture. Like what?
That's done with some of the U.S. based implant companies already. If you have a rupture, they'll pay for replacement, but they won't pay for an explant, or they won't pay for other procedures. They'll get just new implants.
Yeah, thanks, but no thanks, right?
Yeah.
Well, we are at the end of this very informative interview. I can't thank you enough for coming on again, top of the new year, to really just lay it on straight but thick, because women need to know the truth. And this is what you do all day, every day. All you do is remove these guys and make women feel better. So I love the ethos of not only the foundation of your practice, but that you've taken that oath of solely explanting, which speaks volumes.
Yeah, thank you. And it's important to know for women that not every woman with breast implants has problems. But if you are having symptoms, if you are having health issues, it's important to know that this could be your problem.
Ladies, do your research, ask all the right questions, and bring up even the hard topics. Dr. Rankin, thank you so much for joining us and providing such invaluable insights, since it's such a crucial topic.
Thank you so much.
The Rankin Difference is brought to you by DavidRankinMD.com, and you can check him out directly on the gram at David Rankin MD. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.